Members, it's the appointed time. We have a quorum. I call to order the meeting. Agenda item number 1, information papers issued since the meeting on the 18th of December 2023. We haven't received any information papers ever since. Deputy Chair and I had a meeting with Labor and Welfare Bureau on the 19th of January to firm up the work plan in the 2024 session. We met with the Secretary and his team. The items recommended for discussion have been listed on the list for items for discussion. That is information paper CB-2158/2024-01. Some items will be referred to other policy bureaus or panels, and these items will also be removed from the list of outstanding items for discussion. The following items are recommended to be referred to the relevant policy bureau. 1. Promoting the use of telehealth services in the community and residential care homes for the elderly under the purview of the Health Bureau. Many members mention the alleged abuse of the $2 scheme by the Kowloon Motor Bus Company Limited. This is under the purview of the Transport and Logistics Bureau. The following items are recommended to be followed up on by other panels or subcommittees. 1. Policies related to carers. This is under a subcommittee. Next, reviewing the services for residential care homes for persons with disabilities and reviewing the support for persons with disabilities, including the support for persons with disabilities discharged from schools or residential care homes. These are under the purview of the Subcommittee on Support for Persons with Disabilities, which will be formed soon. Next, reviewing youth services and improving policies and measures related to family support. These are under the purview of the Culture, Sports, and Tourism Bureau. We mentioned issues related to mental health. The mental health of students is probably related to the panel on health and education. We've discussed with the relevant chairpersons. Professor Priscilla Lang is willing to discuss this issue. Mr. Kenneth Lang mentioned visiting Community Hall. On the 16th of January 2024, Mr. Kenneth Lang floated this idea, and we will visit the Community Hall on the 26th of March 2024. It will be held in the morning. The next meeting is scheduled for the 15th of March 2024 at 2:30 p.m. The items proposed by the administration for discussion are 1. Community childcare services and neighborhood support childcare projects. Do members agree to discuss these two items in the next meeting? If members have no views, let's get started with the first discussion item. That is increasing working family allowance rates. We have with us Mr. Ho Kai-ming, Undersecretary for Labor and Welfare, and his team. Thank you, Chairman. In a 2023 policy address, the Chief Executive announced that it will increase the rates of the household and child allowances under the Working Family Allowance Scheme by 15% across the board. It aims to support lower-income working households with longer working hours which are not on the Comprehensive Social Security Assistance (CSSA). Under the principle of rewarding hard work, the WFA scheme provides different rates of allowance based on working hours and encouraging self-reliance. The claim period of an application covers the immediate past 6 calendar months. The allowances are determined on a monthly basis based on the household's working hours and income. Each eligible child or youth will be granted child allowance. Starting from this April, child allowance and the allowance amount will be increased by 15%. Taking a 4-person household with 2 eligible children as an example, the maximum monthly WFA they may receive will increase from the current amount of $4,200 to $4,830. This will effectively strengthen the policy objectives of the WFA scheme to encourage continuous employment and reward hard work. This scheme can incentivize more families to join the labor market. The income and asset limits will also be adjusted starting from April this year. Under the mechanism, the government will make reference to the median monthly domestic household income of economically active households. The movements of the asset limits for public rental housing applications will also be taken into account in the adjustment of the relevant limits. We will continue to promote the scheme through different promotion channels. A series of publicity will be mounted, including updating posters and leaflets, directly mailing promotional leaflets to low-income households, displaying information in PRH estates, community halls, bus stops, and so on. Information will be displayed to allow the public to have a better understanding of the situation. We will also hold briefings for frontline social workers of integrated family service centers. This will help them understand the scheme as well as the relevant adjustments. This can help them better refer the suitable cases. We will also use ethnic minority languages to mount publicities. For example, we'll do so through posters and leaflets as well as radio programs and newspapers in order to provide assistance to more family members. This is the introduction of the administration. Thank you, Chairperson. I hope to have the support of members. Members who would like to speak, please press the button. There are 8 members right now. Dr. Ngaman Yu, Mr. Chen Pui-Leung, Chao Siu-chung, Andrew Lam, Dr. Tan Yue-heng, Mr. Tan Ka-piu, Ms. Lam So-wai, and Ms. Lillian Kwok. 4 minutes question and answer included. Dr. Ngaman Yu, please. Thank you, Chairman. I support the measure in relation to the allowance rates. I have 2 suggestions about the WFA. This is the line to take by the DAB. 1. The claim period ranges from 6 to 12 months. We'd like to compress it to 2 to 6 months, so that for families who are in urgent need of government support, they don't have to wait for 6 months. Instead, they will have to wait for 2 months only. Of course, government procedures will be more complicated, but this is a better approach. I'd like what the administration thinks. For the WFA arrangements between 64 hours and 144 hours, some employees are working casual jobs. They may not be able to work for a total of 144 hours, so I'd like the administration to take on board my view. Undersecretary. Thank you, Chairperson. Thank you, Dr. Ngan. I thank Dr. Ngan for his support for the scheme. I know that Dr. Ngan worked in the estates where a large number of members of the public received the WFA. Regarding compressing the claim period, the existing period is 6 months, but it is subject to manpower changes. If we have to further compress the duration to 2 months, we'll need more personnel to check the income and asset limits as well as the working hours of the applicants. If we are to compress the claim period, the application time will be extended. We will not change the claim period for the time being. Regarding working hours, we'd like to encourage full-time employment. The jobless rate in Hong Kong is on the low side. We'd like to incentivize more family members to join the labor market. The maximum hours right now is 144 hours. That is averaging 5.5 hours per day. If we are to reduce it to 64 hours, we may not be able to achieve our policy objective, that is to encourage full-time employment. I understand that the common phenomenon in society is to slash or take casual jobs. But full-time employment is beneficial to employers, for example. That is why we'd like to maintain this level. 88%, over 88% of the applicants can meet the requirements, so we consider this requirement acceptable. Well, I beg your pardon, over 88% have been successful in getting the highest amount of subsidies. The manpower shortage of the government is the reason given by the administration. Well, I think the administration should consider leveraging other technology. Leveraging technology to improve the system. Some application documents are actually the same, just the dates are different. I'd like the administration to consider how can render more timely assistance to families in need. Thank you. Next, Mr. Chen Pui-lang. Thank you, Chairman. In principle, I also support increasing the working family allowance rates by 15%. I have a question. Some applicants are self-employed or they do casual jobs instead of having full-time employment. As at the 28th of February 2022 to 23, there were some 15,000 such applications. So I'd like to know the portion of the number of 20,000 cases out of the total number of applications. Using the integrity system to declare, do you have any inspection mechanisms or any surprise checks to verify the applications so that the system will not be abused? The current system in use is the honor system. Thank you, Mr. Chen. I'd like to invite my colleague from the Working Family and Student Financial Assistance Agency to take the question. We are using a risk-based approach to prevent any abuse, so we will carry out inspections. The WFA was rolled out in April 2018. A task force did identify WFA abuse, over 1,400 cases, accounting for 0.22%. The amount involved is $13 million, accounting for 0.14%. The suspected abuse of the WFA is not common, so we'll continue to use the risk-based approach to make sure public money is well spent. Regarding the honor system, I will invite my colleague to take this question. Some 20% or so use declarations to make applications. This is more common in low-skilled jobs. Apart from surprise checks or inspections, in the course of selection, in the course of approval, we will also check the self-declaration of the applicants. We will check the veracity of the contents. For example, if they are not able to provide documents about their working hours, we'll need to check the bank accounts, as it is an income and asset limit after all. For example, we'll check the bank statement. For a casual worker on a construction site, we may ask the applicant for any safety card or green card held by the construction site workers. There are different types of jobs, and we have different ways to verify the contents of the declarations. We don't accept the self-declarations whenever they submit any.
Next, Mr. Chao Shu-chung. Thank you, Chair. The Working Family Allowance Scheme, it's effective in alleviating poverty. Every year there are about 120,000 successful applications. This is quite helpful to low-income households. This is also a measure that encourages employment. Therefore, I support the 15% increase of the working family allowance rates. I have a couple of questions for the Undersecretary. The first question was raised by one of the members just now. I am concerned about the working hour requirement of singleton households. Say you work 40 hours a week and you work for 5 days, it can be regarded as a full-time job. If you can find such a full-time job, it may not be easy. However, for someone who works a full-time job like this is not qualified for a higher allowance. If you work 190 hours per month, it is considered a job with long working hours. I wonder if the Undersecretary can adjust the threshold of the working hour requirements. Say I do a full-time job, I work 44 hours per week and I work 5.5 days a week. I should be qualified for a higher allowance. I should not have to work for 192 hours in order to get the higher allowance. On child allowance, currently it is tied to the working hours of the applicant. Say if the applicant cannot meet the working hour requirement, he or she will not only fail to get the allowance applied, but also the child allowance. Can there be a buffer period for such applicants, say within a 1 or 2 month times? If the person can meet the working hour requirement, can the child allowance be given to the applicant to alleviate the burden of the applicants? According to the government's paper, there is a high number of WFA active households. The number doubled that under the former LIFA scheme. Understand that there are more people benefiting from the scheme. However, it is not something that we should happy about because it means that poverty is a serious issue still. Does the government have an indicator to assess the effectiveness of the WFA scheme? Also, how many households are eligible for the scheme are not applying for the scheme? Do you have the relevant figures? Undersecretary, please briefly answer the 3 questions. Thank you, Chair. Mr. Chow adopts a macro perspective. We have to look at the asset and income of the applicants. We have the information about the income of the applicants but not the asset information. Can we determine whether the applicants are working poor or not? Is hard for us to determine. It's hard for us to define all the applicants as working poor. As mentioned, under the WFA scheme, 88% of the applicants meet the highest working hour requirement. For instance, if an applicant works 44 hours per week, the person will be eligible for the higher allowance under the scheme. Of course, he may not be eligible for the full rate, but still it is under the higher allowance threshold. So we will keep in view with the situation and see how we should adjust the threshold in the future. We want to encourage through the scheme more people to take up employment. And with the low unemployment rate, we believe it's not hard for people to find a job. We need to adopt a multi-pronged approach to tackle the problems of working poor. We won't resort to just one method to tackle the issue. Can the administration respond to the question about child allowance? Chair, on child allowance, it is linked to the Working Family Allowance, and it is issued with the Working Family Allowance. Say an applicant who fails to secure a job for 1 or 2 months, can we still grant child allowance to the household concerned? Well, that would deviate from our original purpose of rolling out the scheme. So we encourage those who work hard to get a higher rate. Of course, the child allowance can be granted to the applicant if he meets the requirement, but whether it should be delinked with the requirement, we have to look into it. Mr. Andrew Lam, I have a few questions. First, according to the government papers, since 2018, the administration has handled over 684,000 applications, and around 90% have been approved. Say about 52,000 were not approved. That accounts for about 7.6%. I want to know why the government did not approve those applications. What is the standard that you apply when you disapprove an application? As mentioned, you mainly look at the income and asset of the applicants when you approve an application. On estimated expenditure, the administration said that between year 2021 and 2023, during the 3-year period, one staff handles about 180 applications. I want to know how the government has been utilizing the resources. According to the administration, expenditure on staff accounts for about 4% of your expenditure. So I want to follow up on what Mr. Frankie An has asked. Can you expedite your work by utilizing manpower more effectively? I want to know why didn't you approve some of the applications? How can you make use of data to ensure that the application approval process can be conducted more smoothly? This has to do with the operation of the department. I'll ask my colleagues to elaborate later. Since the scheme was rolled out in 2018 April, over 90% of the applications have been approved, meaning that 10% of the applications have not been approved. Reasons is that applicants failed to provide required documents within the deadline, and also the applicants failed to meet the minimum statutory minimum wage requirement or the working hour requirement. Or some applicants withdrew the applications themselves. We ask for the identification cards, the salary proof, etc. when we vet the applications. The applicants will have to let us know how much income they get every month. We ask for such information for a lot of the subsidy schemes run by the government. The head of the agency will tell you how we have been making use of the data stored. Mr. Deng, thank you. We've been promoting the use of online applications in recent years. We want applicants to submit their applications online. A lot of times, applicants fail to provide sufficient information for the first application. Even if the applicant has to submit supplementary information, they can do it online. This will shorten the processing time. And this will also reduce the chances of typo or for us to identify the handwriting on application forms. When we first rolled out the WFA scheme, we didn't have a lot of applications received. It's been 7 years now since the scheme was first rolled out. As mentioned, we sometimes do random checks. And we've been doing a lot more random checks compared to when we first rolled out the scheme. So our staff do not only conduct random checks, they also do post-application checks. They have to reach out to banks to do asset tests or checks. Our staff are also responsible for providing outreach support to those who encounter difficulties with filling in the forms, especially those who are not familiar with the WFA scheme. As mentioned, we hold briefings for frontline social workers. We explain the scheme to them so that when they identify eligible applicants, they will refer the case to us. We need manpower on all these areas or fronts. So compared to a few years ago, our scope of work has changed. Mr. Tan Yue-heng. Thank you, Chair. I support increasing the working family allowance rate. I have 2 questions. First, would it be possible for the administration to take into account the working hours of the households as well as their resting time? Because the rate is linked with the hours the applicants work, meaning that an applicant who works for longer hours will get a higher rate under the scheme. According to my understanding, this is a welfare policy. It is also a poverty alleviation policy. For households with longer working hours, they will definitely receive a higher income compared with households that work for shorter working hours. For some households, they cannot work long hours because of certain restrictions or limitations. For these households, they work for shorter hours and therefore they get less support. They may even lose the eligibility to apply for the working family allowance. So it looks like the administration fails to alleviate poverty in a precise manner or a targeted manner. So Can the administration optimize the scheme? For instance, can you adjust the threshold of working hour requirement or adjust the income and asset limit so that more households can benefit from the scheme? Second, interfacing between CSSA and the WFA scheme. We are talking about the WFA scheme today. We are focusing on working family that earn low income. Some households fail to get CSSA or the Working Family Allowance. For those who fail to get CSSA or Working Family Allowance, well, do we have the number or the relevant statistics or figures? How can we help households to benefit from both of the scheme?
其实谭议员的一个
Thank you, Dr. Tan. Your question is about working hours and income. Regarding the working hours of single-parent household, the working hours requirements have been reduced by half in order to qualify for a higher allowance. That is, the requirement is 72 hours. If need be, they can still obtain the WFA when they have a lower working hour. The CSSA is actually the safety net. When the applicant falls short of the working hours requirement, yes, as we understand, there are these families. They are poor. They are also jobless. For senior citizens at the age of 65 or above, they will be able to obtain OAA, Old Age Allowance. For PWD, persons with disabilities, they may also be able to receive disability allowances. So we have different schemes or plans to help families in different situations. In case we miss anything, we welcome members for your suggestions in order to help the government with targeted poverty alleviation. 5 members are still waiting to speak. I'll draw a line right here. That is after Mr. Michael Tian. Mr. Bill Tang. Thank you, Chairman. I support this scheme. That is to allow more citizens in the grassroots to benefit from the policy. There will also be greater support for children. But as a legislative member, to enhance a regular item, we should discuss the scheme in greater length. That is about upward mobility, targeted poverty alleviation, incentivizing employment. The 4-page documents are not detailed enough. But of course, you still have our support, as after all, there will also be more people benefiting from this policy. But legislative members do want to take a macro approach. This scheme will cause an additional expense of $200 million. So we have high hopes and we do want to have more information from the administration. Here come some concrete questions or suggestions. I'm quite well up in this scheme and I have a couple of suggestions. The Labor Advisory Board, LAB, has made a consensus regarding continuous employment. That is 68 hours for 4 weeks in a row. So are we still going to cling to 72 hours? Are we going to change the number of hours in order to tally with the legal requirement? This is my question. Some families in the grassroots are living from paycheck to paycheck. Right now, we have e-application platforms, and they are actually expecting monthly applications. If they have to wait for 6 months before they can apply again, the amount is actually not small at all. The amount may total $20,000 or $4,000 for 6 months. Thousands of dollars can keep them afloat. So, should we still have the hard and fast rule of 6 months? Next, regarding EMPF, will the EMPF platform be rolled out in 2025? The employee's contribution of the MPF will give you an idea of the actual income of the employee. So we do not have to ask the employer to sign. We can directly use the EMPF platform to transfer the information to prove the household income, so I do not have to urge my employer to make any declaration. The MPFA is considering this. And next, can we have a QR code? That is an instant application method with a QR code. Oh, it's already in place? I believe we do want to help children. A full amount of school textbook assistance scheme will be able to attract full rate allowance. Now that if a family is eligible for school textbook assistance scheme, probably you can remind the family of making an application for the full rate allowance. Some families might have given this point a miss. Regarding 468, I understand there is a consensus with the by the LAB. There are sick leave, annual leave, and so on. Actually, the WFA encourages full employment. So the working hours have to be tied to the WFA scheme. We'll have to map out the future direction only at a later stage. For monthly applications, this is more complicated, as the applicant needs to submit the monthly information. For example, working hours on a monthly basis. I understand members' view. That is, the income may not be that stable. After all, the Hong Kong society does not operate on an instant payment system. We'll continue to study this issue. We hope to expedite the application process or do away with the red tape when we can streamline the application procedures. Next, Ms. Lam So Wai. Thank you, Chair. I support the increase in the working family allowance rates, but I do have some views. Regarding the WFA, the support given to persons with disabilities needs to be strengthened. If a family is obtaining disability allowance, if a family needs respirator, or when one needs to replace the switches of an e-wheelchair, There's a dedicated fund to help this category of people. They are not on the CSSA. They do not receive the WFA either. Some of them are physically challenged. The administration may want to evaluate the situation and assess their needs. Regarding municipal solid waste charging, it may not be under the purview of this panel. But regarding the domestic waste about wound dressing, if the tube needs to be replaced, these are owing to medical needs, so how should they be dealt with? There are MSW charging schemes, so what can we do for them? We may have to ask Mr. Chi Chi-yuen from the EEB. Next, there are generational poverty. The increase in working family allowance rates may give rise to an increase in social welfare expenditure. That is because we have intergenerational poverty in society. When it comes to students with special needs, they require more support. The social welfare department does not have support for them. If these category of students need training, where does the money come from? Some families lack support, so what should they do? What can they do? Should the allowance, should children allowance be relaxed? Especially when it comes to students with special learning needs. Next, about the requirements of the number of working days. Many SWD schemes focus on the number of working days. The economy is on a downswing. Should we allow flexibility in relation to income proof? That is to allow more people to be able to apply for allowances. Thank you, Ms. Lam, for your question. No one single scheme can cater to all needs, and we are talking about the WFA. For PWD not on the CSSA, there are different schemes. Last year, we rolled out a scheme targeting persons with serious disabilities. There is also yet another scheme in place. In 2014, we rolled out another scheme to help PWD to purchase the necessities they need. Through Community Care Fund or other funds, society can also render assistance to this group of people. That is, they suffer from serious physical disabilities, but they are still working in the community. For SEN children, should they receive a larger amount of allowance? We do not want to solely rely on the WFA to give them support. We do want to capitalize on other schemes. Next, Ms. Lillian Kwok. Thank you, Chair. I have some suggestions. Just now, I've heard from the administration that they will brief frontline social workers, but I believe district councilors or care team members fill out many application forms. Basically, back then I filled in probably a couple of application forms every day. When it comes to publicity, we have district councilors after the improved electoral system. Should you also teach care teams in filling the application forms? This will go a long way towards the situation. It's been 7 years or so. There are more applicants, and there are also more resources. When the number is on the rise, does it mean that we also have more people that are in the working poor category? Do you have more figures for our reference? After all, the scheme is aimed at giving them support, encouraging full-time employment, improving their life. But how can we follow up on these cases? We should promote continuous self-reliance. From 2018 to 2023, do you have figures on the increase in their income? There are some 600,000 applicants or applications as set out in the paper. How many of the applicants do not have to make such applications? This may be one of your KPIs and you can show us the relevant information. I'm not sure if you have information or data at hand right now, but if you do not, you can also provide us with information after the meeting. That will serve as good reference. In the future, will there be an allowance for MSW charges? $2 per day for a month, hundreds of dollars. But for a family, they can already buy food for a couple of meals. Some members asked about SEN students. Regarding single-parent families, the parent needs to go out to work. But can we consider, for example, 80% or 60% of the working hours in terms of SEN student families? Students may need to attend training sessions. This may result in a lower number of working hours. If that's the case, can we consider adjusting the number of working hours on a monthly basis? Say, the housing department may also factor in the number of household members, and probably the administration can give it some thought. Next, if it keeps increasing, I'd like to ask the administration, what plans do you have? After all, we can't keep providing support to these families. Do you have any other measures? Thank you.
Undersecretary, if there is an increase in the number of applicants, it means that we are seeing a higher working population in Hong Kong and would be happy to disperse the allowance. On helping applicants to fill out forms, I believe the relevant parties will offer their assistance. We look at the median monthly domestic household income when we approve the applications. On alleviating poverty, the current term government mainly focus on subdivided unit tenants or single-parent households, for instance. So we won't use the scheme as an indicator to assess the effectiveness of our policy on alleviating poverty. Next, Mr. Michael Tien. Thank you, Chair. I support the increase of the working family allowance rates. However, we have to ensure that the public funds are being used effectively. I'd like to ask about the application procedure. Currently, people have to provide receipts, for instance, documents from the IRD, as well as balance sheets. And if you fail to provide the documents, you'll have to make self-declaration. Some applicants, for instance, they may work as a store owner in a wet market, and they may not have money to hire staff to work for them. Say, excluding the living expenses, they earn $20,000 in cash. As you know, 80% of the public markets in Hong Kong, they do not accept octopus payments. They only accept cash payment. Say they report $11,000 as their income to the IRD. The IRD will have to check whether the declaration is correct. And usually the IRD won't spare a lot of effort in checking whether the declaration or the filing of tax is correct. I believe here you're facing the same issue. Well, you mentioned that you conduct random checks, but I don't know what you check exactly. Say if the applicant only get cash payment for his business, and they may be enjoying a double benefit if you fail to check the exact income that the applicant is receiving. I've been asked whether the administration in this context rely on self-declaration of applicants. Say, for store operators or store owners, would you ask them to receive electronic payment for their businesses? And you will disperse the allowance to them based on the receipts they provide. Otherwise, I don't know how you can ensure that the scheme is not abused. I need a response from the administration. I'll invite Mr. Zhang to respond to this question. Mr. Zhang, I don't have the relevant figures in hand now. According to my memory, under the WFA scheme for stall operators in wet markets, for instance, if they apply for the allowance under the scheme, well, we have a very low number of such applicants under the scheme. As you know, store operators, they run a business themselves, so they earn a pretty good salary. Most of our applicants work as, say, security guards. However, some work as non-skilled workers in, say, construction sites, or they work as cleaners. We try to ask them to provide a salary slip or certification from the employers to prove the income they earn. Some applicants told us that they encountered difficulties with providing such proof, and there are voices that we should accommodate these applicants. So to strike a balance, we accept self-declaration from applicants. However, as mentioned, if an applicant decides to make a self-declared statement, we do have ways to check whether the declaration is correct. Say for casual workers who work in construction sites, we ask them to provide the green cards. If they are allowed to work in construction sites, they should be green card holders. Say for people who run small businesses, we ask them to provide a simple balance sheet, and we look at the balance sheets to see whether they look reasonable. Even if they receive cash payment from their clients, we do check their bank accounts. Say if they get $2,000 or $3,000 of transactions in their bank accounts, we ask the applicants about that. we do not totally rely on the honor system when we approve the applications. We understand that some applicants are desperately in need of the allowance, so we don't want to hold off the application for too long. Therefore, we do conduct investigations sometimes. We consult insurers, we consult banks, for instance. We sometimes check records of the transport department to see whether the applicant hold a vehicle, for instance. So you do random checks, and according to your experience, there are ways for you to check whether the income declaration is correct. As to how many checks you conduct, I want to know how many problematic cases you have identified. Perhaps you can talk to the administration after the meeting yourself. Well, you said you've conducted random checks. What were the results of your checks? I'll ask my colleague to tell you the results of our checks. We have a special investigation team. Since 2018, we have completed about 1,000 investigations. They are random checks. Say if we discover that some applicants made false representation, we referred the case to the police. Over the years, according to information provided by the police, 10 people have been convicted. Sentences include community service order as well as suspended sentence. So about 10 people were convicted, meaning that a very low percentage of people were convicted. That's right. Next, Mr. Stanley Ng. Thank you, Chair. I would like to thank the administration for taking on board our views to adjust the WFA rates. However, we do have to assess the effectiveness of the scheme. Since the scheme was rolled out, the number of applicants has been on the rise. Has the government reviewed the number of applicants? Were there any applicants who no longer had to apply for the allowance under the scheme? Also, has the government looked at the jobs of the applicants? Well, you have listed out some of the industries that the applicants belong to. I wonder if certain applicants are exploited continuously by their employers, and they therefore have to apply for the allowance under the scheme. The administration wants to, through the scheme, wants to encourage self-reliance as well as continuous employment. The objective of this scheme is to alleviate poverty. If we keep granting allowance to the applicants and at the same time employers keep exploiting their employees, we'll have a group of people in the city who rely on the allowance scheme. How can we have the 500,000 some people not rely on the scheme?
Thank you, Chairman. We can supplement the figures later on. Regarding the type of jobs, some 30% are service industry. They are cleaners, security guards. 17% are from the construction site. 15% transportation sector. 14% from the catering industry. 7% public service sector, 1.6% for the manufacturing sector, and 14% retail industry. Well, do you have more concrete information, for example, the type of work, the type of jobs, which can show us more information that for some particular types of jobs, they will be exploited, so the administration will be in a better position to protect workers in these industries. We don't identify such phenomena, as mentioned by Mr. Stanley Ng. There are 3 tiers of WFA for 4-person households. The income for an 4-person household with the income of $30,000 or so, they can also make an application. If there are 3 tiers, the applicant can be granted the full amount, 3/4 amount, or even half amount. Mr. Tommy Zhang, do you have a short question? Yes, just a simple question. Thank you, Chairman. Just now, the LAB has arrived at a consensus of 468. It hasn't been firmed up, though. But do you think the legislative exercise will affect the income of these workers? Have you conducted any assessment? If you have no answer right now, you can submit a written reply later on. That is, have you conducted any studies about the LAB's consensus of 648? Well, we haven't yet conducted any studies. If need be, we'll contact the relevant department to look into the situation. Next, services of parents or relatives resource centers. Let us invite the relevant officials to join us.
主席，因為
Just now, the administration has not answered any question from me. So I could not ask in the second round when you have already drawn the line. Do I need to submit a letter to the administration, or will the administration supplement the relevant information after the meeting? Well, the administration will provide supplementary information after the meeting. In the past 2 years, I haven't really received any supplementary information from the administration. Can the Secretariat note it down that the administration will provide us with supplementary information? Thank you, Secretariat. Next agenda item. We still have Mr. Ho Kai-ming, Undersecretary for Labor and Welfare, with us. Please walk us through the document from the administration. Afterwards, we'll invite Ms. Maggie Leung, Assistant Director of the SWD, to walk us through the relevant services with PowerPoint slides. Thank you, Chairman. This paper briefs member on the policy objective of the PRC, Parent Relative Resource Centers, and the support services rendered to parents and carers of persons with disabilities. We understand that these carers and parents are in the forefront. In order to strengthen the support, the SWD has been providing subventions for NGOs to operate PRCs across the territory in order to provide professional support, guidance, advice, as well as other information. PRCs help parents and carers to understand the needs of the PWD at their home, to strengthen their ability, to give them a confidence boost, and so on. Starting from 2018 to 19, the number of PRCs has increased from 6 to 19 at present. We understand that parents and carers also need to take care of their own well-being apart from taking care of the family members in need. There are support groups, recreational activities, care skills workshops to give parents or relatives or carers breathing space. This can also facilitate exchange of ideas. That is how they can rise to the challenges. Some carers or parents actually continue to share their experience with other parents or relatives. These are valuable experiences, and they can also help enlighten other carers. Their role is actually very key. In view of the double challenges due to language barriers and cultural differences, we have set up specialized EM units in central and western Kuntong, Yaotimong, Huaiting, and Yunlong to provide tailored services to EM with disabilities, so that the EM population will not miss any opportunity just because of cultural differences or language barriers. In Kowloon East, there is currently one designated PRC for parents, relatives, and carers of persons in mental recovery. Regarding persons in mental recovery, that is depression, bipolar disorder, psychosis, and so on, there are different workshops, activities to enhance the carer's capability in order to help them better take care of persons in mental recovery. In order to provide more support, the Chief Executive announced in the 2023 policy address that the SWD will set up 4 additional PRCs for carers of persons in mental recovery by the third quarter of 2025. PRCs will also be set up on Hong Kong Island, in Kowloon West, New Territory East, and New Territories West to support persons in mental recovery and their carers. Assistant Director, please, when you're ready. Thank you, Chairman. The SWD provides a series of support services to PWDs to help them develop their physical, mental, and social capabilities. We also promote their integration into the community. We also understand that the carers also need support. We need to strengthen their caring capacity, ease the stress in order to provide a better quality of life. PRCs are aimed at strengthening the function of the family in taking care of the needs of persons with disabilities. Emotional support is provided, professional advice is given to help them learn how to take care of their persons, to help them take care of PWDs. They oftentimes feel weakness when they need to take care of such people. There will be counseling, surface information, support groups, community education, as well as care skills workshops to help these carers. Parents may feel embarrassed when they take their children out. PRCs provide them with a relaxing environment where they can unwind and take their children to take part in activities in the PRCs. They can also enjoy leisurely times such as drinking coffee, having refreshments while exchanging experiences with other persons in similar situations. PRCs will also refer families in need to suitable units for follow-up. We also encourage these families to go out to the community in order to promote integration into the community. All over Hong Kong, there are altogether 19 PRCs. A total of 6,800 groups or programs have been conducted, with participants totaling over 130,000. The SWD has been actively increasing the number of PRCs. In 2018 to 19, there were 6. At present, there are 19. That is, in all 18 districts in Hong Kong, there are 1 PRC. Additionally, there is 1 PRC designated for parents, relatives, and carers of persons in mental recovery. Ethnic minorities also have similar needs. So we have already set up specialized EM units in 5 PRCs located in districts with more EM population. They are in Central and Western, Kwun Tong, Yau Tin Mong, Kwai Tsing, and Yuen Long. We have EM ambassadors in order to remove the barrier in terms of language and cultural differences. If need be, it will also provide support to other PRCs. Just now we mentioned a designated PRC for persons in parents, relatives, and carers of persons in mental discovery. They will learn how and when to seek medical attention or arrange for earlier follow-up. PRCs will also organize different activities in order to help them unwind. In order to give them more support, Mr. Ho, the Undersecretary, said, in the third quarter of 2025, we'll set up 4 additional PRCs for carers of persons in mental recovery. In addition to the existing PRC in Kowloon East, PRCs will also be set up in Kowloon West, New Territories East, New Territories West, and on Hong Kong Island to support persons in mental recovery and their carers. This is my introduction. Thank you, Chairman. Members who would like to speak, please press the button. There are 4 members right now. 5 minutes per member, question and answer included. Ms. Lam So Wai, Ms. Lillian Kwok, Mr. Kenneth Lang, and myself. Ms. Lam So Wai, please. Thank you, Chairman. First of all, in PRCs, undoubtedly there are services provided by these centers. Take Cheung Kwan O as an example. Some residents do not know the existence of such a PRC. Just now you mentioned you have conducted quite many programs, activities, and so on. How are they different? Residents in my district do not see any difference. Is your publicity targeted? While you were walking us through the documents, I was listening to you. But do the residents know enough about the PRC? Do they even know that there is such a PRC? As I mentioned, there should be PWD, SEN, carers of senior citizens. There should be one-stop PRCs. Last week, I met with social workers and the parents of some patient organizations, as well as some carers of PWDs. There are 5 to 6 small groups rendering assistance, but the question is still the same. What is the difference between these PRC and other support groups? In the policy address, however good you claim your initiative will be, how can you implement it? Will you be able to implement it? According to the definition of carers of Hong Kong Poly U, priority is not accorded to the carers of PWD or people in mental recovery. I received many complaints on a daily basis. All of them are about carers. Your PRC in Cheung Kwan O is not known to many residents. I am a social worker myself. I don't mind it, but I don't think this should be the way forward. When the PRC needs to be extended, how can actual services be provided? Will the PRCs still be the same old groups, such as flower arrangements, makeup, and so on? Just now you mentioned coffee breaks. There are many GIC plots of land in new territories. Will you use the principle of one site multiple use? It will be able to provide a comfort zone for the carers to take a coffee break. They can take a breather. They can have massage. They can drink a cup of floral tea. They can unwind. They can take a rest. You don't need a large parcel of land. There are vacant school premises and you can set up a coffee corner, just like the one on the 5th floor of the electrical complex. That will do. I'd like to hear from the administration. Next, for family support or parent support, we have 182 181 2 lines. There are many tragedies in relation to carers, but no targeted support is in place. So when there is expansion of PRCs, how can you render assistance to these parents? Are you just turning these people with suicidal thought away to the relevant department or the police force? I've had exactly the same situations in reality. Don't pass the buck. The telephone operators should not pass the buck. Parents in the grassroots and in the middle class also face the same situation. So carers also need support. Thank you.
Before the administration gives a reply, I'd like to remind members as well as the administration that you may mention a lot of terms that the other side may not understand. For the English abbreviations you use, can you give an explanation of the term that you bring up so that we are all on the same page? Thank you, Chair. We will try our best to use the same language to respond to the questions so that the minutes can be drafted easily. To respond to Ms. Connie Lam's question, we are talking about some very professional services that we are providing to parents or relatives. These centers will receive cases referred by hospitals, so ordinary citizens may not be aware of these services. And this is understandable. For those who do not require such professional services, they may not be aware of them. On the carer support hotline, we do have staff picking up calls now. We have the 182-183 hotline as one of the hotlines. We have social workers who provide outreach support to persons in need. We want to try our best to offer support to people in need. Thank you. To reply to the question about publicity, as mentioned by Undersecretary, in the community level, apart from PRCs, Parents Relatives Resource Centers, we offer other types of support as well. For instance, community centers that offer support to persons with disabilities. On publicity, last year we rolled out the information gateway for carers, and we have been enhancing the website. We want to include as much as information as possible to the website so that people in need will know where to find the services they need. We will work with different organizations to step up publicity so that members of the public, including those in need, know where they can get the services. Thank you, Chair. Ms. Lillian Kwok. Thank you, Chairman. I thank Ms. Connie Lam for the questions she asked. I think what she said is very true. I know members who have called up the hotline for support. We're talking about these PRCs, and I wonder if they can actually offer support to persons with disabilities. Parents of persons with disabilities, a lot of them, they do not know how to educate their children. They are desperate for resources and support. I wonder if you will offer support to parents of children with disabilities as well. The administration gave a briefing on the PRCs. I think the services provided by these centers overlap with some mental health centers, and they also overlap with services provided by, say, integrated family resource centers, for instance. I wonder if you can consolidate all these services provided so that you can offer targeted support. Home Affairs Department also have centers, for instance in Kwai Chung, that offer support to ethnic minorities. However, there are specialized ethnic minority units in PRCs as well. We're talking about one government. Can you not work in silos? Can you make sure that you are effectively using the resources you have? When you provide services through these centers, do you check what kind of services are provided in the neighborhood already? Say 4 organizations may be providing the same type of services for our elders in one community. We want to make sure that public money is well spent. We do not want to see duplication of services provided by the government. Undersecretary. Thank you, Chairman. I understand that members would like the administration to utilize the resources in a targeted manner. However, there are challenges to that. We set up PRCs with a different goal compared to other government departments. We have dedicated teams to serve ethnic minorities upon the request of members. We understand the views of members and we will see how we can improve. We want to have, however, dedicated teams to serve a specific group of people in need. This is our goal. Let's see if Assistant Director have anything to add. I mentioned about people in mental recovery. Currently, we have integrated mental health service centers that provide one-stop services. PRCs and integrated mental health service centers work together. They are complementary to each other. Services provided by the integrated centers are very diversified. There are a wide range of services. They also work with relevant units, for instance, social welfare organizations and schools, to promote mental health. As to PRCs per se, they provide services specifically for parents and relatives of people with mental health issues. For instance, these centers teach parents or family members of people with emotional issues or mental illnesses to, for instance, how to help them take medication. Sorry, Chairman. To be honest, I think the administration can respond to our questions in a precise manner. I thank the Undersecretary for saying that they would work to coordinate with other government departments. Should we adopt a preventive approach instead of offering support to family members of persons with mental illnesses when things happen? How many counselors are working in these centers to offer support to people with mental issues? Chairman, I'll give a brief response here. I hope members can offer some specific examples and let us know how we can make improvement. Members mentioned that in one community there may be 4 organizations providing the same type of services. I want to know which housing estate or which community in particular that the member was talking about. Chairman, excuse me. Sorry. I think the administration should have the information itself. It should not rely on us to provide the information. I have not heard of any one community or neighborhood with 4 organizations offering the same type of services. I have to draw a line here because we do not have a lot of time left. Now, Mr. Kenneth Leung. Thank you, Chairman. I, of course, support giving more help to people with mental illnesses. I've seen the PowerPoint presentation and I've heard the briefing from the administration. I still think that there is overlapping in terms of the use of resources by the administration. What is the difference between PRCs and other type of service centers we have? Does that mean the administration or in these centers, when they identify carers in need, they refer the cases to a specific type of centers or unit? Or do you focus on helping a specific group of people, for instance, those in mental recovery? I hope that there is a clear division of work or kind of triage system among these centers. Ms. Connie Lam mentioned about respite services. I think it's very important to carers. A lot of carers would like respite services, and I want to know if the administration has planned to include respite services into these PRCs. I have read information from the information gateway for carers just now. I think a lot of information is being left out on the website. I think your goal is to provide one-stop services. That means you don't want to have multiple hotline services. You don't want to have multiple counters. Can you tell us what is the difference between PRCs and other service centers? And can we look for respite services through these PRCs? On our triage system, I'll invite our colleagues to elaborate. For those who are not aware of professional services, I recommend you to call 182 183 to consult a social worker. I understand that the information gateway is not readily available to ordinary members of the public. Well, the information gateway for carers has just been rolled out. You cannot just ask us to call up the hotline. As mentioned, we do have a division of labor here. We want to include only specific information in our website, and at the same time we roll out the hotline services because we want to attend to people with specific inquiries.
Commissioner for Rehabilitation, thank you. There are different service units and there seems to be some overlapping of resources. As the SWD colleague mentioned, they have their own respective service targets and they work hand in hand with each other. The Integrated Family Service Centers serve families as a unit. Families cover the young, the old, women, and so on. The coverage is even wider. However, if these centers have cases involving PWDs or people with people in mental recovery, we can make referral internally so that they will receive more targeted and professional assistance. There is overlapping of resources, but there is also division of work. Should we be standalone units without any overlapping of resources at all? This will not be the best support services given to the public. The public may not be having a very clear idea about what they should receive. So it would be better if they have referral guidelines in centers. There are different centers, and in Hong Kong there are altogether 24 integrated centers. We have a total of 24, so some districts may have more than one. For the PRCs we are talking about, some parents may have SEN students. All along, our policy is that we focus on the carers of elderly people, but actually SEN students are also covered. They are also our service targets, and PRCs specifically target these service targets. Which is different from another type of centers. They have a wider scope. They not only care, but they also work on prevention. That is, there may be some overlapping of resources, but there are also different referral mechanisms, like the Integrated Community Center for Mental Wellness, as I mentioned. The Information Gateway and 182, 183, they serve different functions. 182, 183 are for more emergency cases. More urgent cases. For some people who may not be able to use the internet to look for information, they may call up 182, 183. However, there are also people who may want to look for relevant information online. They may not be in urgent need. They may want to select the best services that suit them. So the nature is a little bit different. I hope I've answered members' questions about the overlapping of resources. Thank you, Chairman. Next, Mr. Bill Tang. First of all, thank you, Chairman, for letting me speak first. I recommend site visits by LegCo members if we want to know how good the centers are. Like there is one in Kowloon East dedicated for patients, for parents or relatives and carers for persons in mental recovery. We might as well pay this center a visit. After hearing from the administration, honestly, I still find that the services are mainly for students in mental recovery. It is designed to provide support to these group of people. The focus SEN students are receiving a lot of support from different professionals, but upon graduation, they actually lose all of this support. They may even take a step back. So in the policy address, there are some initiatives that want to address this problem. For PWD that have already come of age upon graduation, is there any measure for them? You said that you had already served 130,000 people. What is your KPI? After all, you have devoted resources. Have you assessed the quantity and the quality of the services provided by these 18 PRCs? I want to know more information. Among the some 19 centers, are there any barrier-free access? For example, the one in Kuntong, the one in Central and Western. They are on Kane Road. Well, I mean, it's on Kane Road. I'd like to hear from the administration. Undersecretary. Thank you, Chairman. We'll further liaise with the Secretariat, but in March, we'll have a site visit to the community hall. We may keep in touch with the Secretariat. Yes, we'll further liaise with the Secretariat about paying a visit to the community living room. It may be difficult to have PRC set up in the vicinity of public housing estates. So many of these centers are located in commercial buildings. The SWD is providing subventions to NGOs. There may be more units in the future, but at present, we are trying to provide as many services as possible, and we will continue to bear this in mind while we look for further locations in the future. Regarding the KPI, I invite my colleague to respond to members. Ms. Maggie Leung, we have performance pledge and performance or service capability. For example, the number of families who have registered, number of activities, number of social education programs, consultation cases, any small groups. Regarding the KPIs, questionnaires, KPI reviews will be in place to take stock of the service. We will also canvass the users for opinions. I thank Mr. Bill Tang for mentioning the initiative about providing support to students upon graduation. We will set up task forces to help. In different service units, we also provide services to different service targets. I'll be brief. So the task forces may have nothing to do with these 19 PRCs. Is that correct? These services will be provided by the Centers for PWD. Second round, I'll allow Ms. Lam to speak. 2 minutes. Thank you, Chairman. I'd like to follow up on my first round. Ms. Maggie Leung or the administration has not yet answered my questions, and I'd like to follow up on these questions. 182, 183, you are passing the buck. You are actually giving parents the runaway. Are you actually just asking these parents with suicidal thoughts to call the police? PRCs are simply passing the buck. I agree that there are support services, but are these services really targeted? You simply you simply can't give parents the runaround. We have the Integrated Community Center for Mental Wellness. There are also other centers in place. But over 10 organizations said that these PRCs are no different from any smaller groups. There are simply no difference. Regarding the complaints about 182, 183, I hope Ms. Lam can give us more information after the meeting. We'd like to contact the Donghua group for more information. Ms. Maggie Lang, anything else to add? Regarding 182, 183, the CARE hotline was rolled out in September last year. Up till now, a total of, well, we don't have any more time. Please be succinct. The hotline is operated by social workers. Social workers also provide outreach services. In urgent cases, they provide outreach cases, and there are also respite services. Some social workers also visit the callers and provide urgent emotional support. And they will also take them to respite organizations. We have data or information to show you that the social workers of these hotlines did provide assistance. Well, I'd like to know the figures. Since September, how many have used respite services, how many crisis management cases that have benefited from this hotline. Well, I can continue to provide information. Maybe hear Ms. Maggie Lang out first. 30% respectively for emotional support and social support. Other support includes financial difficulties. 10% asked about respite services. At present in Hong Kong, there are some 420 accommodation respite services. Respite places. There are also 230 daytime respite services, providing services to PWDs in need. I'd like to take this opportunity to talk about the issue brought by Ms. Lam, that is about small groups. There are different interest classes, activities, and so on, but the service targets are actually different. The format, for example, is also different. They may be smaller groups, but their contents are also different. The activities organized by PRCs focus on helping parents, relatives, or carers. They help them up their skills or how to communicate with the people that they are caring for. This helps them prevent conflicts. In the interest of time, we're wrapping up this agenda item. Next agenda item, AOB. Any other business? No? Meeting adjourned. Thank you, members.